Hi, everybody. Thank you all so much for joining us tonight. I am so excited for you all to be here and to hear about some of the fantastic brain health breakthroughs that have been happening in the cognitive research area over the past decade or so. My name is Lindsay McCormick. I am the founder of the Maryland Center for Brain Health here in Frederick, Maryland, and I am here with Collette, who is the founder of A Mind for All Seasons out in Boise, Idaho. I graduated from UC Irvine in California, and my early career sort of led me upon this mission to bring awareness to things that are happening that people might not necessarily know about and understand. And that has sort of led me on the path to the Maryland Center for Brain Health. I really enjoy helping people learn about their bodies and learn the things that they can do to help them have a healthy and thriving life as they get older. And when I went back to school and changed careers to become a PTA, I discovered that my passion and my one true focus was really helping people to feel better and improve their health circumstances. On this journey, I was thrilled to meet Collette and Randy Vawadri. Eric is the CEO for A Mind for All Seasons. He's a nationally recognized dementia expert. He's a licensed residential care administrator and a teacher at Boise State University and the College of Western Idaho. Together with Randy Vawadri, who is our medical director and the chief architect of the Enhanced Protocol, together they work together to create this incredible protocol that I'm very excited to tell you about today. So I'm going to turn it over to Eric.
Thank you so much, Lindsay. Well, thank you to everybody who's joining us. We're excited to have you here. We hope that if you have questions that you'll either put them in the chat or jot them down, because we're going to have some Q&A at the end of this and hopefully have some great engagement from those of you who are participating with us. If you're watching this on a replay, then we invite you to reach out. We'll provide some contact information, and we want to make sure that you get any questions answered. So we'll create an opportunity for you to reach out. Let's dive in. I want to share some valuable things with you today that hopefully will help you know things that you can do to protect your brain from Alzheimer's disease, or to help those that you may be serving who might be living with Alzheimer's disease or another type of dementia. First, I want to share with you a few sobering statistics. 1 in 9 adults who are 45 and older complain of some kind of cognitive dysfunction. That's scary to me. 45 and older, that's like a low threshold. But there was a University of Virginia study done several years ago that showed that cognitive decline actually tends to start for most people in the late 20s when it comes to certain types of brain functioning. Memory tends to get affected in the 30s, and then it just sort of snowballs from there. And it doesn't need to be that way. I think those numbers are reflective of the way that a lot of us are choosing to live and what that's doing to our brains. So I hope that you'll come out the other end of this with some ideas of what you can do to protect your brain. 1 in 3 seniors currently dies with Alzheimer's disease or another type of dementia. So it is one of the top killers. And as you know, there's not a pill that you can take that will cure it or prevent it. But we do know a lot more now about how to prevent it and what to do if people are living with it. There are more than 5 million Americans living with Alzheimer's disease or another type of dementia, and more than 50 million people worldwide. Actually, those numbers have even gone up a little bit. I need to revise my slide because there's now over 6 million Americans, and I'm not sure what the worldwide number is, but it just keeps climbing, and those numbers are expected to almost triple by 2050. That is scary, and we have to do something about it now. Unfortunately, a lot of the things that people have been banking on, like somebody coming up with a pill, haven't been looking too promising lately. It wasn't long ago that Pfizer pulled out of pharmaceutical research, and there are lots of companies that do research into Alzheimer's disease medications that have just pulled out and basically said, hey, there have been over 400 drug trials in the last couple of decades. None of them cures Alzheimer's disease. None of them has meaningfully changed the trajectory. We've had our hopes up lots of times only to have them dashed. Let's consider for a minute what the typical experience is of adults as they start to age and notice some cognitive problems. A lot of times people will subjectively recognize, hey, I'm slipping. Things aren't quite the same as they used to be, and I'm really worried about it. And eventually they might get the courage to talk to their doctor about it. When that happens, often primary care doctors will do a simple screening test, a pencil and paper test, like the MMSE or the Montreal Cognitive Assessment. And many people can pass those tests. They can get a normal adult score, even when there are serious underlying problems. Alzheimer's disease is at work for 10 to 20 years before symptoms even show up. And there's recent research that shows when people subjectively feel like they're slipping, most of the time, about 80% of the time, they're actually right. But when they go to the doctor's office and they do this pencil and paper screening test that's not all that sensitive, it seems like, well, maybe you're just getting older. When things do finally get worse, and that screening test says, oh yeah, you've got mild cognitive impairment or you've got a dementia diagnosis, then what happens next is often very frustrating for people. I asked a client of mine several months ago what it was like to go to her primary care doctor's office and then to the neurology office to get a diagnosis with her husband. And she said, well, the neurologist did a little bit more testing than the primary care doctor, did a little bit of imaging to rule out some vascular issues, gave my husband a dementia diagnosis, didn't say what type of dementia it was, and then basically said, we've got a few medications that we might try, but I don't think they work very well. They have some side effects, so it's kind of up to you what you decide to do. Why don't you come back in 6 months and we'll test again and see if anything's worse. And I said, what did that feel like? That's where this picture comes in. She said, it felt like the doctor put me in a boat, grabbed the oars, and shoved me and my husband out on a rough sea and just waved goodbye and said, good luck. It was devastating to her to get that kind of diagnosis. And I know from working with thousands of people in the last 21 years that that is a common experience. And I don't think it needs to be that way anymore. Unfortunately, we've come to accept a certain trajectory when it comes to brain health that assumes that as people get older, they're just going to lose their minds. What is common doesn't mean that it's normal. If you looked at people's waistlines back in the 1950s, hardly anybody was overweight or obese. Nowadays, it's a huge, huge problem. And we've come to accept it that, oh, there are just lots of overweight people around us. If someone was really overweight in the 1950s, it would stand out like crazy. So what becomes common gradually becomes accepted, and that doesn't mean that it's normal. So what happens if we accept major cognitive decline as we get older, and we consider that, yeah, people just get a little funny as they get older, they start to lose their minds? Well, it means a loss of our ability eventually to perform activities of daily living. It means institutionalization. It means loss of confidence, loss of our ability to connect with people that we really love. It's a devastating thing. Now, everyone has a different trajectory when it comes to aging. Some people are kind of like the purple line you see at the top there, where it's kind of a slow but somewhat steady decline, and people might live into their 90s and kind of hang in there. Other people crash and burn at a steeper angle. They're like the plane going down in flames, and they crash into the ground a lot earlier. Now, I don't mean to be overly dramatic with this, but I think we've come to accept a lot of things that we shouldn't accept. It doesn't have to be that way. The Maryland Center for Brain Health, under Lindsay's leadership, is really trying to step out now and offer something that's exciting. It's out-of-the-box thinking. It's an opportunity when the whole world is saying, oh my gosh, it's raining, there's nothing we can do, we better just wait out the storm and just deal with it as people have these challenges. She has stepped forward and said, no, let's take action. Let's help people have a better quality of life. What we're going to talk about for the next several minutes is kind of complex, but I want to simplify it for you. The simple version is the enhanced protocol that I'm going to tell you about is hope for brain health. People who apply the enhanced protocol change the trajectory. Here's what the enhanced protocol looks like. Now, there's a lot of stuff here. We're not going to delve into even a fraction of all this stuff. And I don't put up a slide like this to overwhelm you. I put it up because the minute someone says in your earshot, for the rest of your life. There's nothing you can do for dementia. There's no way to prevent it. There's nothing that you can do in terms of intervention. I want you to remember this slide and realize there's a ton of stuff that you can do. It doesn't guarantee any particular result, but there's a lot of things that we can do to help people. And I personally have seen with now many hundreds of people, major improvements in their brain health, measurable improvements with objective cognitive testing, objective lab work, and so forth. So traditional medicine, allopathic medicine, uses a lot of pharmaceuticals. We've kind of grown accustomed to just accepting the idea that if there's not a pill for something, that we can't do a lot about it. Because the pills that we do have that work have been game changers in a lot of cases. The average age at death in 1900 was somewhere in the late 40s. Now that was skewed downward because a lot of people died in childbirth and a lot of people had farming accidents or other accidents, and they would develop infections. But the advent of antibiotics and other sorts of therapies, pharmaceutical medicine, has made it possible for people to live a lot longer. And so the average lifespan has gone up pretty significantly. But that comes at a cost, because the flip side is we've grown really accustomed to treating illness instead of wellness, waiting till we get sick, and then we go to the doctor and we hope that he or she will have a pill that will make us better. And it doesn't always work out that way. People are living longer than ever, but often the last decade or two of their lives is spent with some kind of a chronic illness. And it might be heart disease, it might be type 2 diabetes, it might be that they're morbidly obese and they hurt so badly because they're packing around so much extra weight and it's wreaking havoc on their joints. They may have chronic arthritic pain, and they may have dementia. Lots of other conditions are persistently there for many years at the end of life for a lot of people. Allopathic medicine basically tells people, hey, I'm sorry, there's nothing that I can do for your memory loss. Get your affairs in order. Eventually, you're going to be in a memory care community. And eventually, even though we don't want to, a lot of people, too many people, will wind up on antipsychotic medication. Well, Mind for All Seasons believes that there's a better way. We don't eschew pharmaceutical medicine. Randy, our medical director, was trained very, very traditionally. We still use the very best of what we can get out of traditional medicine, but we also look at things like physical therapy, and we get consents to do some out-of-the-box things, like maybe if someone's in an assisted living facility and it's warranted, we're not going to check on them every 2 hours at night and wake them up all night long. Maybe we'll get some consent from the family and say, hey, we're going to let them sleep, because sleep is really, really important. We do coaching and caregiver support, kind of like chronic care management that some insurance companies are starting to do. We combine the very best of traditional medicine with a functional medicine approach, a root cause medicine kind of approach. And all this comes together in the enhanced protocol with the goal of either preventing cognitive decline or significantly delaying the point at which someone would need to go into assisted living or some other type of community situation. Or if someone's already in assisted living or memory care, we've had a lot of success getting people off of medication, particularly antipsychotics, and helping them function at a higher level. I can't say it's a cure, but boy, if we could help someone function at a higher level and be able to participate more in their activities of daily living and remember their loved ones at least a lot more frequently, that's a win. That's moving in the right direction. So you might consider, what downward slide are you on? What's the trajectory in your life? What direction are things headed for you? We are very confident at A Mind for All Seasons, in partnership with the Maryland Center for Brain Health, that we can change the trajectory. At the very least, we can level things out. We can help you maintain a high level of functioning for a lot longer. So think of what that gap is worth. If you're declining, or someone you love is declining, and we could level that out, what does that mean? Not only financially, but in terms of quality of life. I don't know about lifespan. We're all going to die. The number one cause of death is being born. So I don't think we can change that. But I think we can really impact how people live for the rest of their lives. What's exciting to me is that very often people's cognitive functioning really does improve. We see it in their cognitive test scores. We see it in their overall functional level. We see it anecdotally in what their families report that they're able to do that they hadn't seen them do in years. We work sometimes with younger people who have no dementia, but they're trying to sharpen their mind. And when you see someone's cognitive test scores go up by 20 or 30%, and they say, man, I'm doing so much better at work. I feel like I've got my competitive edge back. That is exciting stuff. Well, how does it work? Where does all this come from? A lot of the research behind the enhanced protocol comes from people like Richard Isaacson at Cornell University, who started the country's first Alzheimer's prevention clinic, and this man, Dr. Bredesen, who's a highly credentialed neurologist who spent a lot of his career at UCLA, and he spent a lot of the last 30 years trying to develop medications for the pharmaceutical industry in response to Alzheimer's and other neurodegenerative conditions. And along the way, he learned some key things about the brain that have really been game changers. So how does all this work? Let's dig into a little bit of the science, because if you're like I was when I first started learning about some of this stuff, I was scratching my head going, I don't know. We've tried a lot of different things and nothing's been a game changer yet. Well, Dr. Bredesen realized, hey, there's about 100 billion brain cells, and all the choices that we make influence those cells because those cells have receptors. And those receptors are waiting for messages telling them what to do. The receptors, in a lot of cases, are like switches. And Dr. Bredesen and his team at UCLA discovered a switch, amyloid precursor protein, APP. And this switch can be flipped one direction toward brain health and growth and doing really well, or it can be flipped in the opposite direction toward synapse destruction, where things are just downsizing. So this receptor in the brain, amyloid precursor protein, is kind of like a security camera looking out on the loading area of a restaurant delivery dock. And it's looking to see, hey, do we have all the right conditions? Are the right things getting delivered? Can we keep everything on the menu? Think of your cognitive functioning, whether it's verbal skills or language skills or auditory processing or memory or anything else, as like items on a restaurant menu. And if the ingredients aren't getting delivered properly, then stuff starts to come off the menu. Now, it may be that if one thing, like let's say the seafood delivery truck doesn't show up, maybe something like salmon has to come off the menu, but you can still make a lot of other things. But boy, if enough stuff is not present, if there are enough conditions not met, and that signaling switch gets flipped in the wrong direction for long enough, then the menu really downsizes. Things aren't working so well. So what are some of the things that impact these receptors? Well, it's not just one thing. What time you go to bed consistently, that's going to affect your memory, and it's going to affect the health of those 100 billion brain cells. Did you exercise? That's a big one. Did you have caffeine? Did you drink alcohol? Did you smoke weed? What kind of medications are you taking? There's a lot of stuff here, and I don't need to read a slide to you, but think about your nutrients, think about your hormones, think about things that you know that research has shown for years are impactful on memory. Take hormones, for example. A Mayo Clinic study from years ago showed that women who had early hysterectomies and they did not do hormone replacement, they had double the risk of Alzheimer's disease. One of the reasons that 2 out of 3 Alzheimer's patients are women is that hormones are crucial for brain health. And the longer a person lives without the nourishing support of hormones, the more decline there tends to be. Now, when you combine that with a lot of other factors, this gets complex quickly, and you start to understand why it might be hard to create a pill. Dr. Bredesen compares a brain to being like a roof. And a brain with Alzheimer's is like a roof with a lot of different holes. He realized that making a medication to try to impact Alzheimer's disease was a little bit like trying to patch a roof that had 30 to 50 holes in it. You might patch one hole really well, but that roof is still going to leak. And now if you patch a big enough hole, You use a medication like Aricept or Namenda or Exelon. Maybe we can measure in some clinical trials that the rate at which that house is filling up with water is a little bit slower, but you're still going to drown. It's still going to fill up. The perfect Alzheimer's drug would have to do so much stuff. You just can't make one pill to do all of that. So Dr. Bredesen had what seemed like kind of a radical idea. He said, well, we can measure those holes in the roof. There's a lot of that stuff that we can measure. We can measure nutrients, we can measure hormones, we can look at inflammatory markers, we can measure the presence of toxic elements, things like lead and mercury and herbicides and pesticides and so forth that are toxic to the brain. We can look at all of that stuff. What if we do a really broad panel of labs for people and measure all of those factors and develop a personalized program for people? It would look different from one person to the next. It's like there's 50 potential holes in the roof, but you have these 20, and oh, you have 18, and you have those 30. So here's your program and your program and your program. Well, he tried that with 10 people, and the results were phenomenal. He published a paper in 2014 called Reversal of Cognitive Decline, a novel therapeutic program. When is the last time you heard reversal and cognitive decline in the same sentence? Crazy, right? Well, let's consider one of the people from that study. 9 out of the 10 had really impressive improvement. We don't have time to go through all of them, so I'll just tell you about one of them. He was a 66-year-old man with complaints of memory loss. He had some genetic tendencies that elevated his Alzheimer's risk. He had a positive family history. He had a PET scan that was really consistent with Alzheimer's disease. So for all intents and purposes, you could say, yeah, this guy is definitely showing symptoms of Alzheimer's disease. They did an MRI, and it showed that his hippocampal volume, translation, the memory center of his brain, measured in the 17th percentile. 17th percentile. He was missing a lot of the control tower for his memory. And yet, after 10 months of treatment with a multimodal approach, where he was replacing nutrients he was deficient in, replacing hormones, he was exercising, he was prioritizing sleep, he was getting more oxygen to the brain by making sure that sleep apnea was taken care of. He was eating differently in brain healthy ways. He was doing some brain training. When all of that stuff was combined together, after 10 months of treatment, his hippocampal volume was in the 75th percentile. And the radiologist who read the report went, no way, this can't be true. And so they sent it off to another lab that used one of the other 2 computer programs that analyze MRIs in this manner. And they came back and said, no, we think he was in the 10th percentile and he wound up in the 90th percentile. Now, I don't care if a person starts in the 17th percentile and gets to the 75th, or the 10th and gets to the 90th. The fact is this guy regrew a lot of his brain, at least the memory center of his brain, and functionally he was doing so much better. Now, you might think that's crazy. When I was a kid, I was told, once a brain cell's gone, it's gone. You don't grow new brain cells. But in the last couple of decades, researchers have confirmed that indeed the memory center of the brain produces about 700 new brain cells every day. So if we can tip the balance, if we can quit losing those brain cells faster than they're formed, and we can tip the balance the other direction, gradually, maybe people could start getting better. Well, in this case, he certainly did get better. Dr. Bredesen published another trial of 10 patients in 2016, and then in 2018, he published this paper on 100 patients. He has now trained about 1,500 practitioners in different parts of the world. And there are thousands of people who have used this method. So much so that Dr. Bredesen recently came out and he said, hey, there's enough data to know Alzheimer's should be a rare disease. We can prevent this. It should be as rare as leprosy or polio. When is the last time you met somebody, at least in the United States, with leprosy? It just doesn't happen. And yet here's a top neurologist with over 200 peer-reviewed articles in the last 30 years, a true Alzheimer's expert who is bold enough, based on the data coming in from all these studies and all these people that have had interventions, to say it should be rare. We shouldn't even be going down this pathway. It's a lifestyle disease. Well, Randy, our chief medical officer here to Mind for All Seasons, read Dr. Bredesen's early studies, and he dug into all the footnotes. He did a lot of extra research. He looked at the work of others. When I first met Randy and started working with him, he hauled out this massive binder. It was like an old family Bible, kind of super thick book. And he just put it down on the table, started flipping through it, showing me all the research he had done. And there is a ton of different work that has piled up over the years, verifying different aspects of what actually goes into what Dr. Bredesen found at UCLA. So Randy started applying those techniques with patients here in the Idaho area in his primary care practice. And they started getting better, just like the participants in Dr. Bredesen's study. And he was so blown away. It was like the future was here. It was amazing. And then as soon as Dr. Bredesen started offering some training for practitioners, teaching them these methods, Randy was one of the first people to sign up and go get it. As we have seen now hundreds of people, and when I say we, I mean Randy and I, at A Mind for All Seasons in the last few years, we've seen this with hundreds of people. We've done lots and lots of lab work. What we've seen is that what gets labeled Alzheimer's disease is different from person to person. For some people, it's an inflammatory type of dementia. Their inflammatory markers are just sky high. Their body's immune system is chronically activated. In about 80% of dementia cases, people have massive insulin resistance. You might call it glycotoxicity. Insulin resistance drives type 2 diabetes, it drives the obesity epidemic, it drives heart disease, and it's the reason that Alzheimer's disease is nicknamed diabetes of the brain. Insulin is like the key that unlocks the gateway to get sugar into the cells so it can be turned into energy. And if that key is broken, because it's been jammed into the lock so much because we've eaten such high levels of sugar that it just doesn't work anymore, or because you have some genetic tendencies that elevate your risk and you eat the standard American diet on top of it, then you wind up with a nation of people who are insulin resistant. And that means that you're not getting gas into the tank. And if you don't put gas into the tank, the engine doesn't run. These people respond so well to intervention. And people in earlier stages of cognitive decline, where maybe it's just subjective, or maybe they're just a little brain foggy. Maybe they're the 45-year-old software engineer that just can't hardly concentrate anymore because he's been pounding down Cokes every 30 minutes trying to stay awake on a 3-day binger doing coding. When people like that shift their diet and they start improving insulin sensitivity, amazing things happen. Some people have an atrophy type of dementia. That's why we call it atrophic. Atrophic comes from atrophy. These are people that are really deficient in nutrients and hormones, and their thyroid functioning is just really suboptimal. When you improve those conditions, oftentimes these people do much better. Other people have more of a toxic dementia. They develop Alzheimer's disease symptoms earlier in life. And when you do genetic testing, you find they don't even have the genetics that would elevate their risk. They really shouldn't have it. Frequently, they look like the picture of health. Many times they're active, they eat pretty well, they're heavy exercisers, and you think, why on earth are they developing these dementia symptoms? And then you do further testing and you find out, oh, they've got heavy metals in their brain, or they've got mold, or they've got herbicides or pesticides built up. There's all kinds of things that are toxic to the brain. And Dr. Rudy Tanzi at Harvard found that amyloid beta protein, the stuff that forms the sticky plaques in the Alzheimer's brain, it's actually antimicrobial, and it might be part of the brain's immune system. We think that it binds to toxins and protects the brain. Now, for many, many years, Alzheimer's research has been based on the amyloid hypothesis, which says that amyloid protein is both a cause and the symptom of Alzheimer's disease. That's why most of the drugs developed have been geared toward trying to get rid of amyloid, like doing a radiator flush or something in the brain, so to speak. Well, we have drugs that will get rid of amyloid, but nobody gets better, and a significant portion of people get worse. Could it be that amyloid is being produced for a really important reason? It's kind of like white blood cells. What if we notice that every time you get sick, every time you get strep throat, for example, your white blood cell count goes through the roof? We know that that's the immune system, but what if we didn't understand that? What if we mistook correlation for causation? What if we said, oh my gosh, every time you're sick, your white cell count goes up. We need to make a drug that will get rid of the white blood cells. Well, you wouldn't get better. People would be dying of strep throat because the immune system would now be compromised. What if amyloid beta protein is just like that? Dr. Bredesen suggests that a better question than how do we get rid of the amyloid is, why is the body producing excess amyloid in the first place? And at least for a lot of people that we've done testing with, it seems to be because they have toxic exposures. Some people have more of a vascular component to their Alzheimer's disease. Now, there is such a thing as vascular dementia brought on by strokes and mini strokes and chronic hypertension. But we're also finding that pretty much everyone with Alzheimer's disease has a compromised vascular system. There's a lot of damage that goes on there. So we have to keep that in mind. Some people have Alzheimer's symptoms because they've had chronic head trauma. Maybe they had a huge concussion and it really knocked some things offline and things spun out of control from there. Or maybe it's just chronic traumatic hits to the brain. Football players, for example. So what do we do with all this? Well, personalized medicine. You do baseline cognitive testing, you come up with an individualized plan to deal with it, and you provide coaching and help. Dr. Bredesen developed a program he calls RECODE, Reversing Cognitive Decline. It's a brilliant intervention. It's hard to do, though, without coaching, without systems, without tools, without people to guide you through the process. The enhanced protocol takes everything that Dr. Bredesen has developed and builds a system around it that makes it easier for people to implement, and then adds to it the work of a lot of other researchers and a lot of other modalities that improve how the body functions. Let me give you just a few case studies before we shift gears to some Q&A, and we try to help you get answers to whatever you might be thinking about. So first of all, this is a situation with a woman who presented with some elevated inflammatory markers. She also had some key nutrients and hormones that were depleted. You see a few of them on this slide. But let me just tell you about her. When she came into the office and sat down across the desk from me with her husband, she could hardly talk. Now, she was young, 55 years old. She had been working at a school, working with special needs kids. And over the course of a few weeks, she started having serious cognitive challenges. She couldn't use the spreadsheet program she was used to using to track things with her students. Her supervisor would give her instructions, and she couldn't follow through with those instructions. It became painfully difficult for her to do her work. Eventually, her supervisor said, I know that you're not feeling so good. Why don't you take a couple of weeks off? In the course of those couple of weeks, she started losing her balance, and she became nearly aphasic. That means she couldn't put her words together. And when she sat across the desk from me, she would just stumble to get words out. She'd get so frustrated, she'd turn to her husband and say, you tell him, I can't talk. Well, that's not a normal thing for a 55-year-old person. And so we started into a program. Now, she had gone to a neurologist here in our city who said, I'm so sorry, you have Alzheimer's disease. There's nothing I can do. That wasn't good enough, so they went off to California to one of the research hospitals. They met with a team there, and the lead neurologist came back and said, I'm so sorry, you have Alzheimer's disease and posterior cortical atrophy, where the back of the brain deteriorates and it affects your vision. That's why her balance was starting to get off a little bit. There's nothing we can do. Thankfully, a friend of theirs knew about A Mind for All Seasons, referred her, and we put in place a program, and she started making some impressive improvements. She went to the point that now she can carry on a pretty normal conversation. She can do CrossFit with her daughter. She couldn't even find our office previously, and now she can ride her bike on her own. She couldn't walk, and now she has the balance to ride her bike. I want you to hear what one of her daughters had to say about this, because I think it's reflective of the hope that people need to have. Now, I want to emphasize this woman still has challenges. She still has to come into our office and still work through all of this. She is not cured by any stretch. She is functioning a lot better though, and it's made a massive difference in her quality of life. Here's what her daughter has to say.
A year ago, it was like we got the diagnosis, and for my sister and I, it was just gut-wrenching because you thought you lost your mom. It was really hard for us to accept that and be told that there was nothing that they could do. So when our friends told us about this place and that what you were doing, like, it was the only option, and it was hands down the best decision that could have been made, because she has come tenfold from where she was just in October. She's able to function, to talk, enjoy her grandkids, be a person again, and be independent, where she wasn't able to do that in October. It's incredible, and I can't wait to see where she is years from now. Like, I got my mom back, and it was quick.
Now, I think quick is kind of in context. It was at least 6 months of hard effort to get to the point that she was doing a lot better, and she's just continued to go forward. But that's amazing in the context of what she had been told by a couple of respected neurologists. This next case study is totally different. Instead of such a young woman, we're talking about an 83-year-old retired hospital administrator and college professor. And she had a baseline cognitive score of 24 on a Montreal Cognitive Assessment. That meant that she had mild cognitive impairment, and she was kind of trending toward dementia. She had terrible problems with short-term memory. She couldn't remember her phone number. She couldn't tell you her address. She knew the city that she lived in, but she just didn't have a memory for stuff like that. And this is a lady that managed massive multi-million-dollar budgets, and she could tell you line items off the top of her head. This was not a normal thing for her. She'd always been a numbers person, and it was galling to her that she couldn't remember her own phone number. She had one copy of a gene that elevates Alzheimer's risk. So definitely a connection there with things like insulin resistance. And if you have a copy of that gene, it really primes you for a more robust inflammatory response than the average person. And we saw that some of her inflammatory markers were elevated. We also saw that her kidney functioning wasn't great. Her filter wasn't working as well as it should be. Now, as she went through some intervention with the enhanced protocol between November of 2019 and June of 2020, her cognitive test score went from 24 up to 27. Well, 26 and higher is a normal adult score. So she went from a diagnosable condition of mild cognitive impairment to a much, much better place. And her husband reported that, hey, she's able to do stuff that she wasn't able to do. Let's listen to her talk about it in her own words.
At a point where I was retreating, I think, socially from other people, because I was having a great deal of difficulty finding words, and my speech was obviously impaired. I also was having trouble with numbers, which I couldn't remember my telephone number or my address.
What are some of the things that you have noticed, Ruth, as far as outcomes in your experience?
Well, I have found that I'm much more comfortable in social situations, which is very important to me, to have that ability to communicate with other people. I'm doing better in terms of memory of numbers, and I can now remember my telephone number and my address, which is a big deal to me. I mean, after years of managing budgets in millions of dollars and remembering every line item, I could not remember my telephone number and address. So I can now. That for me somehow is a major achievement, and I'm progressing. I do believe that I'm going to get much better. Was at a point.
Well, just a couple of other case studies here, and then we'll go to some discussion. This man was a 63-year-old man. He was the executive vice president of a major commercial insurance company, high-level thinker, and he started struggling mightily, and he couldn't figure out what was going on. And as things progressed, he eventually went to his doctor, who really didn't have any answers for him. He ended up going to the Mayo Clinic and having a really thorough workup and getting a diagnosis of early onset Alzheimer's disease. By the time we started working with him, his Montreal Cognitive Assessment score was at 22, and he could not complete CNS vital signs testing, which was a much more involved neuropsychological battery that we use. He had both copies of the most common gene that elevates Alzheimer's risk, and he had some elevated inflammatory markers. He was deficient in some key nutrients. But one of the other things that came out with him is that he had some toxic exposures. Now, this guy was a heavy exerciser. He was actually a PE major in college, and he never gave up being physically active. I mean, he goes to the gym religiously every day. He runs several times a week. This guy's in phenomenal shape for his age. And it's crazy to think that a guy that had eaten well, had been active, had kept his mind sharp, was developing Alzheimer's disease. What is going on here? What's driving this? Well, as we looked into things and did some toxicity testing, we found things like xylene and various styrenes in his system, and acrylamide, and all sorts of chemicals. We found some herbicides, we found pesticides, we even found some molds in his system. He lives in Arizona, and the air conditioner in his building just runs nonstop, or air conditioner in the office building that he used to work in, I should say. And we suspected there was probably mold in the condensing unit, and it just blew into the building. He lives next door to an orange grove, and they spray it regularly with stuff. So he did not do very well. We put him on a treatment summary. When I say he didn't do very well, I mean he was not doing very well being right next to that orange grove. We put him on a treatment program to get rid of a lot of those toxins. And over months of effort, he's seen major reductions in a lot of these, 62% reduction in some of these fuel additives and styrenes, and 80% here. Look at this, his organophosphates and organopesticides, 100% reduction in that. Now, there are a few things that he's increased in, and we've traced that to diet. Eating eggs will elevate acrylamide, so we're dealing with that. But this guy's functional level has improved pretty significantly. So let's listen to he and his wife talk about this.
What kinds of changes have you both noticed as this has gone on? Maybe, Dave, we could start with what you've noticed in yourself and how you have felt about participating in the enhanced protocol. And then, Deb, let's get some feedback from you as well.
I'm stronger. I'm not going to say, I'm lifting weights stronger, but physically I can see better, I can hear better, and I can express myself much better verbally.
I was a little bit skeptical because this has been a death sentence. I mean, even now, people hear and they send me little crying emojis. We're so sorry about your husband. I'm like, because you don't know what you're talking about. But so I was skeptical. And every week, Eric would call us and say, how's it going? I'm like, it's not. This is not happening. All we're doing is not eating sugar. And I just don't see the incremental growth. But when you live with someone 24/7, it's hard to see that. But all of a sudden, in the last month or two, I've got my husband back. And his sense of humor, his sarcasm, which actually was a nice vacation, not having that for a while, but he's back. And we're not out of the woods. I don't want to pretend that everything's wonderful, but he is back. And we engage in conversation, and he plays with the grandkids, and it's been remarkable. And it was like just turned on like a couple of months ago. Both these neurologists before, I mean, Mayo Clinic, you can't get better than Mayo Clinic, but it was like a Band-Aid. Here, do you want the Cinderella Band-Aid or the Batman Band-Aid? Because that's all we have. And it nothing to do with diet or stress level. Dave's stress level was off the charts. You guys just went through every nook and cranny of his health and life and sleep and stress level, and it's made a gigantic difference. Why? And it makes so much sense. It makes so much sense.
All right, last case study. Isn't that exciting? I love seeing the way that his life has changed. And he's been engaged now with the enhanced protocol for two and a half years, and he just continues to make slow, steady improvements. He's getting a little bit better all the time. That is such a different trajectory than heading toward long-term care. All right, so this last case study, interesting one, 70-year-old man who was, again, very healthy, seemed like the picture of health, very successful man, highly engaged in a lot of productive things and a lot of great business deals, kept his mind active. He typically ate really, really well. Not the picture of someone that's going to have a major health problem. But all of a sudden, things really started changing for him. He developed a tremor in his right hand, and he couldn't make a fist in his right hand. And his personality totally changed. He became really hard to be with, to the point that his family members did not want to be around him. And he ended up having some terribly tragic things happen with family members leaving and not wanting to be part of his life anymore. He would snap at people. He couldn't control himself the way that he used to in social situations. He knew that something wasn't right, but he couldn't figure it out. He lived with that for a few years, and he got to the point that his memory was really impaired as well. He couldn't remember a phone number long enough to deal with it. Well, he came to us, and we started doing testing and realized there's some toxicity involved here. There's got to be some toxicity involved. Usually those Parkinson-like symptoms are related to a toxic exposure. Well, sure enough, when we did heavy metals testing, his mercury was off the charts. This yellow line that you see here is the total amount of methyl mercury. Now, in his case, that was coming from fish because he was so wildly successful in business, he could eat anything he wanted. Food budget was no issue. So he ate sushi like it was going out of style. And he had really, really high levels of mercury, and his body didn't do a great job clearing it. Well, when you combine that with inorganic mercury down here, which was also elevated, you get a total mercury burden that's in the 99th percentile. This little white line, if you can see it down there, that white line represents the CDC average for mercury. He's totally off the charts. So we did a detox program using some oral supplements that would push that mercury out of his system and catch it in the gut, and then he would excrete it through bowel movements. And he did that very faithfully. And look at the results. The yellow line's before, the blue line is after. When his mercury levels dropped this substantially, he got to where the tremor went away. He could make a fist with his hand. He can remember phone numbers just fine. He's noticed lots of other memory improvements as well. And his personality is coming back. When we first started working with him, it was frankly very difficult because he would snap, he would blame us for things that were completely his fault. His reasoning and judgment were totally impaired. And now they're not. Now it's like he's his old self. He's great to be around. So one of the questions that we started asking when Randy and I were developing the enhanced protocol, we noticed that some people were just more stable and other people had these major improvements. And we started saying, well, what is it that would tip the scale further? Why is it that some people are just more stable, but they're not having more improvement? We decided maybe there are other counterbalancing things that we could bring into the mix. And we started doing research into medical devices, many of which have been around for decades. And they do things like improving blood flow, calming inflammation, helping people detoxify, stimulating mitochondrial functioning. That's energy production in the body. Many of these devices are even FDA registered. Lots of athletes use some of these devices. They just don't get used in older adults or in the average everyday person. And Randy and I started saying, wow, it's almost like you need a gym for the brain. You need a place to come, and instead of going from the leg extension to the bench press to other stations, you would do audio visual entrainment, and then you do pulsed electromagnetic field therapy, and you do photobiomodulation and all these techniques. And I just threw out some words that some of you probably have never even heard before. But we basically pulled together that idea. We started buying medical devices, and we found that some of the people who were more stable but not really improving started showing improvement because we were nudging them further. Many of these devices calm inflammation significantly, and some of them are FDA approved for treating pain or depression or stimulating bone growth. There's great studies on a lot of this stuff that's out there. So at the Maryland Center for Brain Health, Lindsay has started putting together some of these tools to enhance the ability to use this overall multimodal approach that stimulates better brain health. Now, that gives you an overview of all of this stuff and how it all works together. I want to tell you, though, we've just barely scratched the surface. We could talk all day and all day the next day. Lindsay would tell you how much training she has had and how many countless hours we've spent talking about the science of this and how it all fits together. But I want to leave a few minutes here for some Q&A and to talk through anything that you might be wondering about. So let's see if there's anything in the chat. Oh, Lindsay says the volume is very low. Oh, I'm so sorry about that. Lindsay, is the volume low when I'm speaking, or is it just on one of the videos?
Just the video, the last video.
Okay, shoot. Yeah, I shared the sound, and it's a little bit tricky on the audio. I apologize for that. Well, let's open it up to some discussion. Who has some questions among our participants? You can put it in the chat, and we'll be glad to answer that. So we'll just monitor the chat here a little bit. See if anyone has anything to say. One of the more common things that people want to know about is there a point at which it's too far down the road to intervene? So quick story about that. One of the earliest clients that Randy and I ever worked with was a lady whose daughter knew me from my work at Boise State University. And the daughter had actually read Dr. Bredesen's book, The End of Alzheimer's. Her mother was living with Alzheimer's disease, and she had been on hospice for 2 years. She just somehow kept qualifying for hospice. She had a lot of decline, but it wasn't quite fast enough. And she just was hanging in there, even though most people on hospice die within 6 months. And she said, I don't know if I can let my mom just continue down this path without knowing that I've tried everything that I could possibly do. Would you do this protocol with my mom? And I said, well, I can't promise you anything. I have no idea. She hasn't walked in 2 years, and she hadn't talked in 2 years. So I have no idea what you'll get from this. You might spend a whole bunch of money on some lab work and rescind hospice and go down this pathway, and she may show zero improvement. She said, I understand that. Money is not an issue. I just want you to do it. So we did. And we found that she was very deficient in lots of key nutrients and hormones, and she had a lot of inflammation going on. Her thyroid functioning was pretty bad. And so we just started working on all those things. And she was like 93, almost 94 years old when we started doing this. Within a couple of months, she went to where she was walking with a walker and someone assisting her. And when her daughter would take her home on the weekend, she was able to navigate the steps. There were 3 steps from the garage into her daughter's kitchen. And at first they had the fireman carry her in. And then she was able to take those steps with one person assisting. And then she was able to do it on her own. And then within another month or 2, she started giving appropriate one-word responses to questions. And then she started occasionally saying sentences. But when I first met her, you could walk up to her and put your hand out to shake her hand, and she'd stare right through you. Within just a month or two, she started looking and smiling and shaking your hand and acknowledging that you were there. She started to come back. All right, so that just gives you an idea that I don't think it's ever too late to try to improve things for somebody. Tracy, thank you so much for asking a question. Tracy says, I'm concerned about my dad and his issues. I think Lindsay might be able to help him, but I'm sure he'll be very hesitant. Any advice to convince someone to come and see her?
Good question, Tracy. We get this a lot.
Yeah, that's a great question. Lindsay, do you have any ideas before I chime in on it?
I would say, Tracy, maybe just talk to him, maybe share a little bit of what you've learned today. I will have the recording of this that I can share with you if you think he might be willing to even just sit down and watch it with you. And I don't know, what has been going on with your dad, if it's something that you've already broached to him, or if it's something that he is already aware of. But I think maybe just starting that dialogue with him if you haven't already.
Yeah, thank you. That's awesome, Lindsay. I would also add to that, because this comes up with lots and lots of people, that the answer really kind of depends on the cognitive functioning of the individual. But if someone is aware that they're slipping, or they're still high functioning, maybe they're not aware, because the whole paradox of cognitive decline is you don't remember all the stuff you're forgetting. So if memory loss is a major feature for you, that's kind of a problem. But if someone is still fairly functional, then it's often helpful to not talk about your worry of their decline, but to talk about their desire, which is to maintain their health, to maintain their independence. I haven't met many people who don't want to maintain their independence. And you might say something like, wow, I've become aware that there are some powerful new tools out there to help people maintain their health, to keep their minds sharp, to maintain their independence, to improve their memory a little bit. And I would love to help you learn a little bit more about that. There's some things that could be done to help you maintain your functioning as you get older. Oftentimes that resonates really well with people. Sometimes people are just afraid that their family's trying to figure out how bad things are so that they can put them in a home, as they would put it. And that's not the goal here. We want to keep people in the home that they live in now. We want to keep them from moving, and we want to help them improve. That's the message that I think a lot of people need to hear. We can also certainly take this offline, talk through the particulars of your individual situation, because there may need to be a customized approach. All right, great question. Hopefully that's helpful. Any other questions as we come toward the end of our time here? Sometimes people want to know about cost. And I won't speak for Lindsay as far as Maryland Center for Brain Health and how things are working, but I know we have worked really hard, and I know Lindsay has worked really hard to ensure that 3 months of intervention costs way less than 1 month of assisted living. Assisted living tends to cost $5,000 to $10,000 a month, and you can get 3 months of intervention for a small fraction of that. It can be a lot less than that. This is a very affordable program, and we've worked really hard to make it affordable for people. So it's, unfortunately, it's private pay at this point. It's not something insurance covers, though we're working on that. We're negotiating with various insurance companies to provide the data necessary for them to consider this. But at this point, it's a very affordable program. And there are some different options that might make it easier for people to participate in different ways. So we invite you to look into that and to find out what you could do to make that happen.
Absolutely. We never want cost to be the reason that somebody doesn't seek out help. So we're always willing to work with people. Like Eric said, the enhanced protocol is not the only protocol that we have. Everybody can get a very individualized program based on what their needs are and what they feel that they can afford at the time. And we're always willing to work with interest-free payment plans. Anything that you need, we're willing to work with it. So don't let that be a deterring factor.
Fantastic. Now, sometimes people ask, Well, my loved one is really far down the dementia pathway, and I don't think I want to do anything heroic. They're comfortable, they're not on antipsychotic medications, they're not having behavioral expressions that are really out of character for them. Things seem to be doing okay, and I don't want to do anything to try to turn that around. I'm okay with that. I just want to know how to interact better. I want to know how to support them better. There is so much coaching that can be provided. So one of the things you can get, speaking of these other programs through Lindsay at Maryland Center for Brain Health, is guidance on how to interact, how to support your loved one, how to really maximize the time that you have with them. So whether you're younger and you want to prevent dementia, let's say you've got a family history of it and you realize, oh my gosh, symptoms take 10 to 20 years before they show up. I want to do something now to make sure I don't go down that road. Whether you're that person or you're supporting a loved one that's already really far into dementia, there are things that can be done to help improve quality of life, improve brain functioning, and help people have a better experience as they age. We really want to just change the trajectory of aging and give people greater hope for higher quality of life. Well, Lindsay, let's wrap it up here so that we can stick to our time a little bit. If you have other questions, certainly reach out to Lindsay. We put her contact information up here on the screen, but what would you share in terms of closing thoughts here?
I would say that just first off, thank you all so very much for coming this evening. I hope that you got something out of it, that you found it useful. And if you do have any other questions, like I said, please don't hesitate to reach out to me. I know sometimes in a forum setting like this, people might be hesitant to, put their concerns out there, but that's what I'm here for. I'm here for you. I'm here to address any concerns or needs that you might have for yourself or your loved one on, anything. If you are just noticing, you just want to get healthier, you want the prevention aspect. If it's your family members and you're just not sure what to do with them, Eric and I are here for you. And so I just am really appreciative of you, supporting. This is a new venture here in Frederick. It's a new business and a new company that's starting up that I really feel is going to give us a lot of hope. And I think that that's something that's really been missing in the world of dementia and Alzheimer's is that word hope. And I think that now we finally have it.
Thank you so much, Lindsay. Those are great words. And I agree. There's every reason to have hope. One last thought that comes to mind is that sometimes people don't recognize issues related to brain health that really intervention in a multimodal way like this, where we're digging into root causes affecting brain health could make a difference. It's important to call out things like that. So if you've had a concussion, you may have triggered things like an eating disorder or a sleeping disorder or changes in personality. Lindsay has some powerful tools that can help in a situation like that. If you've got mental health challenges and you're wrestling with that, really looking at the overall physical system and how it affects the brain, everything from gut health to hormonal levels and how it all ties together. Lindsay has powerful tools to help with something like that. So whatever it is that's affecting your mind and your quality of life, reach out and find out what she has that can help. And we'll be here on the back end at A Mind for All Seasons, providing all the support that we possibly can to everybody. So thank you for watching. We'll wrap up and we'll post this on YouTube later on. So if you want to revisit this, it'll be out there for you and you can share it with friends. And we hope you'll like it. We hope you'll subscribe to Lindsay's YouTube channel as well. So thanks again, everybody. Have a great rest of your night.
Thank you. Good night, everyone.